Okay. Welcome everybody this morning to a lecture that I love giving, talking about headaches. Headaches are one of those really unknown things sometimes, and trying to find solutions or giving patients relief from headache care is extremely important. My name is Dr. Dave Adamson. I'm a chiropractic physician. In my past life, I was a physical therapist, and I'm currently in medical school. So I have years and years of experience in dealing with patients with a variety of orthopedic issues, as well as neurological issues, and this topic called The Truth About Headaches. So my goal today is to give you some basic information about what headaches are, what they're not, maybe some treatment options, contributing factors, and ways that you can take care of yourself at home, as well as possibly when seeking medical attention would be advisable. So to get this started, I just want to talk to you about the fact that headaches have been one of those things that cause people disruption in their lives. There's a lot of different things out there that said about headaches that we have to be aware of. Number one, when should I be really concerned? And really concerned headaches are those things that where you are having so much pain you can't think of anything else, and you've never had that symptom before. So as we said down here, anything that's abnormal or things that don't seem to go away, and if you're having that chronic or where you're getting 3 to 4 hours worth of headache that's not really going away, those are things that might cue you in as something you want to take care of or seek medical attention for. Many people with regular headaches find themselves reaching for medication quite often, and that's a normal response, but there's a lot of different ways that we can actually manage these symptoms, a lot of the pain that we deal with. So my goal today is to kind of talk about some of those things. So you're not always grabbing for the medication. You're not looking for medication to actually solve your problem. Although I can tell you, I'm the first one to tell you that sometimes you have to. And the biggest reason is medications have lots of side effects, primarily kidney issues. And when we start shutting the liver and the kidneys down, our overall health suffers tremendously. So I try to encourage patients to do things other than medications when they first come in with headaches. Try to resolve them or give them just a little bit of comfort. Headaches that are not normal. To accept the fact that headaches are normal is not a normal thing. If you stubbed your toe, the toe hurts, you wouldn't assume that the toe pain is normal. If you fell down and hurt your back, you wouldn't assume that back pain is normal. There is no normal in terms of headaches. Usually there's an underlying cause as to why the headache is occurring or even reoccurring. Interesting fact, headaches account for over 10 million doctor visits in the United States alone. In 2003, there was a study done from the Journal of the American Medical Association, and headaches are costing the American public about $61 million every year just for a lousy headache. So there's a tremendous amount of reporting, a lot of different treatment options out there for you. We classify headaches in two different classifications. One, which everyone's hopefully have heard of, which is called migraines. And then the second is the tension stress, or what we call in the industry a cervicogenic type of headache. These are classified differently because migraines have a different causation typically than does stress or tension headaches or cervicogenic headaches. 20% of American population actually deal with migraines. Migraines are that overwhelming pain in the head that causes a major disruption in your life. Things that you can't sleep, it might cause an upset stomach, dizziness, and a variety of other things. So about 28 million Americans every year are dealing with migraines. Typically it's going to be higher in female than in male. Again, we talked about the nausea, the vomiting, some of the other things like visual disturbances, or even what we call photophobia, which is an adverse reaction to light because the headache is so great. Classical with that aura or the fuzzy look, about 10 or 15%. These are typically migraines that are a lot more severe than those headaches that don't have the aura, which is about 85%. And a lot of times we bring this back to a physiological response, such as lower blood sugar or even elevated blood sugar. Certain foods, hormones, we know smells can actually trigger migraines as well. Some people will get very dizzy, or if they're in the back seat of a car and they get some vertigo, that might trigger a migraine as well. And identifying these triggers is extremely important. Most people that have migraines or history of migraines usually have somebody in their family. If your mom or your dad has migraines on a regular basis, you got about a 50% chance of at least experiencing one migraine in your lifetime. Sometimes it's more often than that, but that's something that we take a medical history on to really determine what is the cause. And if it is a genetic predisposition, then we kind of treat you a little bit differently. Despite years and years and years of lots and lots of research, really we still don't know what causes the migraine headaches. There's a lot of philosophies out there on dealing with them, but nobody knows for certain. What we do know that most of the migraines that are happening is because of the vascular tissue that's changing in the brain. And you have to remember that the brain is encased into a very hard, the skull, or the hard substance of the skull. So anytime we get expansion of that brain tissue or nerve tissue, that compression is what causes a tremendous amount of headaches. This is the brain, and this is the vascular tissue that feeds the brain. It's not all of it, but I want you to know that the vascular tissue that feeds the brain, there are 4 pathways to the brain. So you have vertebral arteries and you have carotid arteries. And those things go to feed the brain because it's extremely important. So when we get restriction in these or we get a dilation of these, either way, it can actually set off a series of migraine headaches or even just general cervicogenic headaches as well. There's a variety of care out there. Medical care, prescription medications can be used to help cut these down. I have a personal experience with my son who does deal with migraines on occasion, and sometimes we have to give him the medication. The medication is designed to soften the pressure in the skull by decreasing the amount of blood flow and increasing the amount of positive good flow through the brain so you don't have the compression. Physical therapy, chiropractic, and massage have all shown tremendous positive results in dealing with migraines. There's a lot of homeopathy as well as herb treatments that help a tremendous amount with patients that are dealing with this. As well as there's just a lot of different things. I know it seems like everybody's aunt who's had migraines have their own home remedies that tend to deal with it. And I find that patients have their own way of dealing with each one of these migraines. So we really work with patients on trying to figure out what works best for them, whether it's sleep, staying in a dark room, wearing sunglasses, hot baths, heat around the neck tends to help out quite a bit. Maybe do take some of the medications and or caffeinated type of products like coffee and soda actually has shown tremendous success in decreasing the amount of pain that's experienced during a migraine headache. Tension and headaches. 88% of the women reporting typically deal with tension type headaches. Tension, what does tension mean? Tension means stress. The more that we're stressed and the more we keep this emotion going on in our neck and our upper back, we're going to deal with a lot more of the tension type headaches. Usually this is bilateral, meaning you have pain on either side of the temporal lobes. It can be one-sided versus the other. We do know that a lot of these type of headaches have this vice-like compression that you feel like that's on your head. A lot of that has to do with all this stress that's built up into the neck and the upper back. And there's a little guy with a vice going over his head there, which a lot of my patients can relate to. What we find is a lot of these tension-style headaches or stress-style headaches typically are because of the musculature that we see in the neck. It could be because of a postural deviation, it could be because of an injury, it could be a variety of different things. But what we do is we take a look at these neck muscles to try to determine what would be the best way to release that tonicity or the restrictions in the musculature. But why are the neck tensions, or why does the neck muscles create a tremendous amount of tension? Usually because of forward head posture or what we call misalignment. So I like to actually demonstrate this because I think a lot of us can relate to it. Or we might be on the computer a lot and our head's forward quite a bit, or we're leaning back and we got this forward going. And all these muscles on the front get tight and these ones get long. That forward head posture puts a tremendous amount of stress on the base of the skull. So every time we address a patient with forward head posture, one of the things we like to tell them is for every inch that you move your head forward, we're going to add about 10 pounds or more of weight to the weight of the neck and the upper shoulders. So we really try to get the weight back. So if your head were to weigh 12 pounds, we add 10 pounds on by moving forward an inch, or even 20 pounds by adding 2 inches. We create a lot of stress and angle into the neck. And in today's world of cell phones, computers, or even just a lot of desk work, that forward head posture turns into the problematic area. And this is what we're talking about. Here we have a patient that is showing good alignment, where their ear is over the center of their shoulder, so this neck is in balance. When we see this, where the chin is jetted forward, we have a straightening, or what we call a kyphosis type of development in the cervical spine, and we're way forward of the shoulder, which is here. That's what creates all this tension in the front and in the back of the neck. This causes a tremendous amount of pain. So basically, that forward head posture causes a lot of a continued poor ergonomics, or body position, imbalance of the muscles, and going untreated can create more problems, as well as patients that come in after an auto accident where they get hit from the back. So all this postural deviation leads to these things in the body called subluxations. Basically, a subluxation is a misalignment of the structure, or in this case, the cervical spine. Those misalignments can create tremendous more stress on the musculature and the nervous system, and that all perpetuates itself into things like headaches. But it also can move into things like vertigo, vision issues, smell issues, sinus issues, and a variety of other things. But the subluxation itself is something that we take a look at and trying to correct. As a chiropractor, we look at these things and evaluate them, and we determine what is the cause of the subluxation, but ultimately the treatment for it is getting that subluxation or the misalignment corrected. So this, called the irritation of the nerve, no longer happens. When that nerve creates a lot of, if we create a lot of irritation on the nerve, the muscles are going to react to that. So we like to try to figure that out for a patient and help them out. So as stated, a cervical subluxation, we should have a nice curve in the cervical spine, as you see here on your right side, to try to keep the center of mass of the skull right over the shoulder. That's extremely important. So on the x-ray here on the left, if we have a lot of straightening and we don't see this curve that we have over here, this creates a lot of pressure into the neck itself. Because the next step that's going to happen is this patient head is going to start moving forward. On top of that, we see a lot of other issues that will start to arise, where it might be the disc issue in the neck, making one of those cervical discs herniate or at least bulge, as well as the arthritis that develops in the backside of these on the facet joints of the cervical spine as well. The nervous system coordinates all matters within the body. And this is one thing we talk about a lot in chiropractic care, is that the nervous system, your brain has to communicate. It does this through a series of networks, starting with the spinal column, which travels down your back, goes out to the nerves pick up the signals, come back, go back up to the column to the brain, so the brain can kind of determine what the best course of action is going to be. One of the things that's always been fascinating to me is how much, or how little actually, irritation of the nerve it needs to have in order to create dysfunction. In fact, there was a study that was done about the pressure that is about equal to the weight of a dime can actually cause 60% of the function loss in a nerve itself. So if you just think about how much of a dime weighs and how much pressure it only takes to irritate a nerve or cause dysfunction, it's very, very little. So our body's really equipped to really be sensitive to make sure that the nerve function is proper. The nerve itself travels throughout the whole body. Typically, and this is one thing that we're not taught a lot, but a nerve that runs out of the brain and goes down, clear down to your foot, is the same nerve. So the nerves are long, and they can get irritated along the path anywhere. And that's why we look at subluxation, primarily in the neck to start with, but it can be as far down into the low back as well, that's causing problems above that spot. The cause and effect. If we have nerves that are not functioning, so if you have a nerve that comes out of your chest and comes and innervates your stomach, and that nerve, we shut off that signal, then that signal can't be sent to the stomach, or the stomach can't send signals back to the brain to coordinate care that needs to happen with the body naturally. And again, that's a chiropractic philosophy, and it's something that we practice on a regular basis. So we simply just take a look at the overall system, look at the organs that are involved, and try to create a solution for that. I'm not a big advocate of calling chiropractic as a cure for everything that's out there, but I have learned this over the years of doing this, is that if I can correct the spinal subluxation, if I can take the pressure and the irritation, a much better chance of resolving their issues than if they didn't. Even with the best medical care, the best physical therapy, the best drugs that are out there, if the nervous system is functioning correctly, we have a better shot at having the body heal properly. Because the body controls all functions of the body through the nervous system itself. What causes subluxation? Simply put, thoughts, toxins, and trauma. Thoughts, number one, because stress. How many of us have stress? I think all of us have stress in our life. What about poor posture? We talked about that forward head posture. What about trips and falls, auto accidents, repetitive motions? Those type of things all create dysfunction in the spinal column itself. It can also cause dysfunction in the other parts of our body. Knees, hips, feet, elbows, hands. All those things have dysfunction, which causes pain and discomfort and ultimately arthritis and other types of injuries that we treat in our office. Lack of exercise or sedentary positions, like if you're on your computer all day long, 8 hours a day, sitting going like crazy, you're going to have a tremendous amount of problems over the long run, because that body position will lead to other problems. I'm going to hit on this real quick. Toxins. Toxins are anything that your body reacts to. I'm sure that anybody in the audience has gotten ill before and they've actually vomited. You know how violent of a force that is. And that's an exaggerated response, but still we have a lot of those micro responses that happen in the body as well. Especially if you're eating foods that just don't agree with you, or you might have consumed something you shouldn't, or a medication that doesn't respond well with your body. All of those things are going to lead to other problems down the road. So how do we get it corrected? Exercise is probably your best medicine in anything that I can prescribe to a patient. The other thing, physical therapy, that's what I've done for many, many years. Chiropractic care is definitely one of the best ways to solve a problem with vertebral subluxation, because a good chiropractor will look at vertebral subluxation, assess it, correct it, and we should get an immediate response afterwards. We also have massage, of course, is a huge benefit for patients who are very tight, especially those cervicogenic type headaches are really good. Attention to posture, correcting ergonomics, and reducing stress. Pretty simple. Little yoga class, a lot of stretching, a little meditation goes a long way to help with a lot of these headaches. Exercises at your desk. We give this out quite a bit. If you do sit all day, we talk about taking a break every 30 minutes to try to do some kind of stretching. So we actually created a way to exercise at your desk and avoid this thing called an upper cross syndrome. Upper cross syndrome is basically stated this: all the muscles in the front are short and tight, and the muscles in the back are long and weak. So we end up in this upper cross position like this, and you'll see it in older populations. As they get older, they start to fall into themselves. So understanding this from an exercise or movement pattern allows us to develop exercises and stretches that actually reverse that process. Now, I'm here to tell you that some people are just genetically predisposed to be in that upper cross position. So maybe they just have a little bit of kyphosis because that's the way their moms were, their dads were, so they've passed that on genetically to patients. And I know this because I've treated enough twins, identical twins, and see their spine, see their posture, to know this is a hereditary issue. No matter how hard they work, they're going to deal with this to some extent. So our goal is to correct it the best we possibly can and do the best job we can to keep the body healthy so it can protect itself from having all of these headaches. Here's a couple of exercises that you may have done on your own or have seen in the gym. Just stretching the pecs or the upper body by bringing the arm back, strengthening the back. by pulling. Anything you're doing to pull the shoulder blades back to help with that posture is going to help with that forward head posture. You'll see this gentleman down here also using a machine doing the same thing. So really focusing on posture and focusing on stretching the front and strengthening the back really helps decrease the amount of upper cross syndrome issues that we have. How about ergonomics? How many of you taken time to set your desk up correctly? Is your monitor correct height? Your monitor, you should be looking at the top third of your screen all the time without having to move your head. Most people we see have their monitor too low, so they're down like this. By getting the head up as you're typing, either on a swivel arm, put some books underneath the monitor, something to get the monitor up so you don't have to look down will be very, very helpful in determining whether or not you're going to deal with a lot of these stress settings that we see. Seated position, don't lean back. Make sure your feet are flat on the floor, that your knees and your hips are approximately 90 degrees. All these things can be seen here and are things that we assess with patients all the time to try to decrease the amount of headaches and bad posture that they have. Medical treatment, these are things that we do in our office. We do a lot of trigger point injections. When those muscles get too spasmy, we go ahead and do a trigger point injection, which is we use Marcaine, which is like a lidocaine, which numbs the area a little bit with some saline and Toradol or acetaminophen that help decrease that tonicity of the musculature so the patients can relax a little bit. Certain medications, you can get prescription medication, especially for patients that severe migraines, can get on some medications out there. Again, they're all going to have side effects, so we try to avoid those as much as we can, but sometimes just to give the patient release, medications are needed. Joint injections, if their joints are very arthritic, it's important for us to address that issue as well to help with the overall position of the neck. And this is something that we do quite a bit in our office for a variety of conditions, not so much for headaches, but stem cell therapy that we use in our office for headaches has been extremely effective, especially for patients with migraines. Just a quick story, we had a 67-year-old male who had dealt with migraine headaches for most of his life, 40 to 45 years of migraines where he's taking tremendous amounts of ibuprofen on a regular basis. And we did a stem cell injection at the base of his skull. It was interesting because after we did the injections, I did not hear from Bill. Bill took a long time to come back in, and he's a very simple guy, and I appreciate him tremendously, but when I asked him, I said, "Hey Bill, why haven't you been in a while?" And he said, simply looked at me and said, "I haven't had a headache." So after a gentleman has spent that long dealing with headaches, and then literally shutting them off within a week or two by doing stem cell injection, we know there's a lot of benefit to growing some of the new tissue back, so it can give patients tremendous relief. And in this particular case, stem cells help solve his migraine issues. Spinal manipulation. We do what we call a multimodal approach in our office. Multimodal, multi meaning many, and modal meaning different modalities like physical therapy, stretching, chiropractic care, laser therapy, heat and stim. Those are all things that we do in our office because we know from research there isn't one isolated therapy that works best. We find that the combined therapies actually do much, much better. Exercise and nutrition is a big part of what we do in our office because let's face it, folks, we're a sedentary society. We need to get up, we need to be moving, but we need to do it correctly without injuring ourselves. We have medical doctors, we have physical therapists, we have chiropractors all in our office that are educated on doing this. So we know with the hundreds and thousands of patients that we treat, the multimodal approach actually has the best outcomes for any patient for most of conditions, especially with headache. Best care, maintain proper body weight. That's number one. Don't be overweight. Don't do things that put you in a weakened state. Exercise regularly. Now, we're not talking about just, working out 5 days a week or 7 days a week. 3 times a week, 15 to 20 minutes is a good start. We want to get to a point where we're actually doing some strength training and some aerobic training both. It's extremely important. How about just eating good food? Most of us don't eat enough vegetables, believe it or not. So trying to make sure that we're eating nutritious food really, really helps. This one is always funny. I talk about this on a regular basis. Everyone on the planet will say they have too much stress. So what I ask my patients is, what are you doing for stress management? Do you meditate? Do you sit quietly for 10 to 15 minutes a day? If you started sitting for 10 to 15 minutes a day in a quiet, dark room and really focusing on your breath, relaxing, it's amazing the amount of health benefits you get just from doing that. And of course, watch your ergonomics. If you're at a position for a long period of time, or even if you've got a long drive ahead of you, are you set up correctly to sit for a long period of time without destroying your body? One of the things that we really pride ourselves on in our office is helping our patients. We want everyone in our office to benefit from the care that they receive. We take it personal and we take it professional when patients don't get better. And usually what happens, if a patient's not getting better, we'll find the problem and we'll figure out why they aren't getting better. And as I tell every patient that walks in my office, my goal is to help you and to create the best working diagnosis. And if I can't help you, I'll find somebody else to help you. Thanks for taking the time to tune in and listen to the little talk that we had today. If you have any questions, give our office a call. You can reach us at 239-948-1222, or you can send us an email at info@connexushealthcare.com. And if you want to just come in to do a consultation, we never charge for that. If you want us to review your case, talk to you about what you're dealing with, just a conversation is absolutely free. So feel free to give us a call, book that free consultation, come in. Let's see if we can help you. If not, maybe we can refer you on. Thank you very much and have a great day.